Have you ever felt a sudden sharp pain in your tooth and had absolutely no idea what it meant? You're not alone. Tooth pain is one of the most common reasons people end up in a dentist's chair. But here's what most people don't realize. Not all tooth pain is the same. And the type of pain you're feeling, it's actually telling you something specific. In this video, I'm going to decode every major type of tooth pain, what it feels like, what's causing it, and when you actually need to see a dentist. Cold sensitivity pain. You take a sip of cold water. For a fraction of a second, you feel a sharp, quick jolt that vanishes almost immediately. This is called dentinal hypersensitivity. Beneath the hard outer layer of your tooth, the enamel, sits a softer layer called dentine. Dentine is full of microscopic channels that run straight toward the nerve at the center of your tooth. When enamel wears down, or when gums recede and expose the tooth root, those channels are left open. Cold liquid travels right through them to the nerve. That's the zing. Up to 1 in 8 adults experiences this regularly, making it one of the most common dental complaints worldwide. The key detail here is how quickly it disappears. Cold sensitivity pain that vanishes within a second or two is an early warning signal. Uncomfortable, but not a crisis. Mention it at your next checkup. But if that pain lingers for 30 seconds or more after the cold is gone, that's a different type entirely, and we'll get to it in a moment. See a dentist when the sensitivity is new, getting worse, or simply bothering you day to day. There are effective treatments, but the longer you leave it, the more the enamel can continue to wear. Sweet sensitivity pain. You bite into a piece of chocolate or sip a sugary drink, and there's that familiar wince. Not cold, not heat, just sugar, and it hurts. Sweet sensitivity almost always points to early tooth decay. When bacteria in your mouth feed on sugar, they produce acid. That acid gradually dissolves your enamel, creating tiny openings that expose the dentine underneath. Just like with cold sensitivity, those open dentinal channels allow sweet substances to trigger the nerve. The mechanism is nearly identical, the cause is slightly different. It can also signal a small crack in the tooth, a leaking filling, or early gum recession. What all of these have in common is that the tooth's protective outer surface has been compromised in some way. See a dentist when you notice consistent pain with sweet foods or drinks. Sweet sensitivity is almost always a sign of something that will get worse without treatment, and the earlier a cavity is caught, the smaller and simpler the fix. Pain when biting or chewing. This one is deceptive. It hurts when you bite down, but only sometimes, maybe only on one side, maybe only on certain textures, and then it's gone. The most common culprit is cracked tooth syndrome, a hairline fracture in the tooth flexes under biting pressure. The crack is often completely invisible, even on x-rays. It's more common in people who grind their teeth at night, or who have large older fillings that have weakened the surrounding tooth structure over time. Pain on biting can also come from a loose or failing filling, a fractured cusp. That's when a piece of the outer tooth wall breaks off, or in some cases, a dying nerve inside the tooth. Here's why acting quickly matters. A crack caught before it reaches the tooth's nerve can usually be treated with a crown. Once the crack reaches the nerve, you're looking at root canal treatment. And if it extends down into the root below the gum line, the tooth may not be salvageable at all. See a dentist when you notice consistent pain on biting, even if it's infrequent. The inconsistency is exactly what makes cracked tooth syndrome easy to delay. Don't let that be the reason you lose a tooth. Constant throbbing pain. This is the one that keeps you up at night. A deep, relentless, pulsing ache that seems to throb in time with your heartbeat. It doesn't need a trigger. It's just there. Constant throbbing pain almost always means the nerve inside the tooth is under serious stress, either from advanced decay that has reached the pulp, the soft living tissue at the tooth's core, or from a dental abscess, which is a pocket of bacterial infection that has spread beyond the tooth into the surrounding tissue or bone. With an abscess, the pain is intense. It can radiate into your jaw, ear, or neck. You might notice swelling in your face or gum, a fever, a foul taste in your mouth, or difficulty opening your jaw fully. An untreated dental abscess can spread to the throat or airway, a condition that can become life-threatening within hours. This is not a type of pain you manage with over-the-counter medication and willpower. Gum pain around a tooth. Not all pain that feels like it's coming from a tooth is actually coming from the tooth itself. Sometimes it's the tissue around it. Localized gum pain, a soreness, tenderness, or throbbing specifically in the gum around one tooth, can signal a periodontal abscess. That's an infection in the pocket of tissue between the tooth and gum. You might notice swelling, redness, or a small raised bump on the gum that's sensitive to the touch. More widespread gum tenderness, especially gums that bleed when you brush or floss, usually indicates gingivitis or periodontitis, gum disease at varying stages of progression. Nearly half of adults over 30 have some form of periodontal disease. Gum pain is one of the easiest types to dismiss. It's often low grade. A little tenderness. Some bleeding, easy to ignore. But gum disease is the leading cause of tooth loss in adults, ahead of cavities. And it's also linked to cardiovascular disease, diabetes, and complications in pregnancy. What starts in your gums rarely stays there. See a dentist when any persistent gum pain, bleeding, or swelling around a specific tooth. Wisdom tooth pain. If you're in your late teens or 20s and you feel a deep, achy pressure at the very back of your mouth, there's a strong chance your wisdom teeth are involved. Wisdom teeth are your third molars, the last teeth to come in. Most adults have 4 of them, 1 in each corner. The problem is that modern human jaws often don't have enough room to accommodate them. When a wisdom tooth doesn't have the space to emerge fully, it becomes impacted, stuck beneath the gum, pressing against the tooth in front of it, or erupting at an angle. Impacted wisdom teeth can cause a dull, constant ache at the back of the jaw. They can also cause a condition called pericoronitis, infection and inflammation of the gum tissue partially covering the tooth. This produces a sharper, more intense pain that can spread into the jaw and throat, and it's often accompanied by swelling and difficulty opening the mouth fully. See a dentist when any new pain at the back of your jaw, especially if you haven't had your wisdom teeth assessed. An X-ray will immediately show what's happening beneath the surface. Referred pain, when it's not your tooth at all. Here's something that surprises most people. Sometimes what feels exactly like tooth pain has nothing to do with your teeth. Referred pain is when the source of a problem is in one location, but the brain interprets the signal as coming from somewhere else. In dentistry, this happens more often than you'd think. Sinus pressure is the most common example. The roots of your upper back molars sit directly beneath the maxillary sinus cavity. When your sinuses become inflamed from a cold, allergies, or a sinus infection, that pressure bears down directly onto those tooth roots. The result is a dull, aching pain across several upper teeth simultaneously, often on both sides, that worsens when you lean forward or move your head quickly. Jaw muscle pain from clenching or bruxism, grinding teeth during sleep, can also mimic toothache, producing a widespread dull ache across multiple teeth that's typically worse in the morning. And in less common cases, cardiac conditions can refer pain to the lower jaw, which is one reason unexplained jaw or tooth pain alongside chest tightness or shortness of breath should always be taken seriously. See a dentist when you have tooth pain but no obvious dental cause, especially if it arrived alongside a cold, congestion, or jaw soreness on waking. A dentist can quickly rule out dental origins and point you in the right direction. Post-treatment sensitivity. You've just had a filling, a crown, or a scale and polish. And now your tooth hurts. Did something go wrong? Post-treatment sensitivity is extremely common and in most cases completely normal. When a dentist works on a tooth, drilling, filling, cleaning around the gum line, the tooth undergoes minor trauma. The nerve inside can become temporarily inflamed, producing sensitivity to temperature, pressure, or biting that wasn't there before. For routine fillings, this sensitivity typically resolves within a few days to 2 weeks. For deeper fillings, placed close to the nerve, or after crown preparation, where more tooth structure is removed, it can take a few weeks longer. The pain should gradually reduce over time, not intensify. Sensitivity that is getting worse, or a new throbbing pain that develops several days after treatment, is a signal worth calling your dentist about. In some cases, a deep filling can irritate the nerve enough that root canal treatment eventually becomes necessary. But this is the exception, not the rule. See a dentist when post-treatment pain intensifies rather than fades, or if you develop a throbbing ache or swelling after a procedure. So, which type of pain brought you here today? Drop it in the comments. And if this video helped you understand what you're feeling, subscribe. We put out a new dental explainer every week.